Kim, I think you bring up a great point in that we have 10,000 people turning 65 every single day. And I think those advanced directive conversations and those end of life conversations are going to become a little bit easier as people lean in to aging. So, what's the normal process that someone who's asking about hospice or advanced directives, what's the process that you go through as a company?
The process is first of all, what we try to find out is, do they already have a healthcare agent or a healthcare proxy, somebody that they've designated to make medical decisions for them. You'd be surprised how many people do not have someone. That's a really important question for us, particularly if somebody has a terminal illness, even if they're not on hospice yet, because there is going to come a point where someone has to make medical decisions. So we have that discussion and why that's important. And once we can establish that there's someone available to make those decisions, then we talk about what exactly that person wants and how we will facilitate what their needs are at a certain point, whether it is hospice or palliative care, because there is a difference. Palliative care can be just keeping somebody comfortable at home, whereas hospice is a much more comprehensive service that's provided by an additional agency besides caring people. So that's another key point to know, what someone wants. Do they want hospice, or they just want to be kept comfortable at home? And then, go ahead.
What would you say is the biggest challenge when you have someone walk through the door or an inquiry about palliative care or hospice? Their lack of understanding, or is fear a barrier?
Fear is definitely a barrier, not always for the patient, but for the caregiver. For some of these people, they've spent the last few years caring, and now they're going to face the unknown in those last few months of that person's life. They don't know what hospice means, and everyone assumes that hospice is it. Once you make that, there's no more quality of life. And we have to try and help them to understand that there is still dignity in those last stages, and that making the patient comfortable will also help the caregiver through that process, because no one really wants to go through that alone. And if they can allow us to help them do that, we really can make it a lot easier. It's never easy. I mean, they are facing dying. But the more support they have and the more that they allow us to get involved, I think the better it is for the patient and the caregiver.